Philadelphia, May 6, 1953. This exact day, there was a successful heart surgery with the assistance of the heart and lung machine. For 26 minutes, the heart and lung machine was plugged into an 18-year-old girl's arteries and veins that oxygenated and pumped blood throughout the body. Now benefiting everybody suffering from cardiopulmonary diseases, the question to be asked was, how was all this achieved? How was this barrier who benefited countless families broken? To find out, we're going to look back 30 years. For countless generations, people were suffering from heart diseases like emboluses that left untreatable were fatal. In the 1920s through 1930s, medical research money had been scarce, so it was hard to fund medical research among building equipment. Until after the immediate post-war, there was a large flow of money allowing things like the heart and lung machine to actually be a thing. But the original thought of such a machine was in 1931 when John Haysham Gibbons Jr., a resident, witnessed the death of a patient from pulmonary embolectomy, also known as removal of an embolus. This caused John Gibbons to formulate ideas on if he could replace the functions of the heart. The cause of curiosity affected the future of medicine completely. His original idea was for a machine that could transport deoxygenated blood, then oxygenate it and pump it back into the bloodstream. Gibbon was an intern to Dr. Edward Churchill's surgical service at the Massachusetts General Hospital. He was ordered to observantly monitor the vital signs, pulse, and blood pressure of a 53-year-old woman who had a surgical procedure to remove her gallbladder. The woman had a large pulmonary embolism 15 days after her surgery. His attending, Dr. Churchill, planned that if she still deteriorated so badly, he would perform a dangerous procedure of the time known as a pulmonary embolectomy. As John Gibbon intensely monitored every beat of her heart, while looking, it occurred to him that the true remedy was a machine to deoxygenate blood from her enlarged veins, oxygenate it, and pump it back into her bloodstream. Though she died after the emergency pulmonary embolectomy, it sparked a strong influence on John Gibbon's future. A quote from the manuscript, The Development of the Heart and Lung Apparatus by John Gibbon. My job in the operating room was to take and record the patient's pulse and respiratory rates and blood pressure every 15 minutes. From 3 p.m. one day to 8 a.m. the next day, the operating team and I were side of the patient. Finally, at 8 a.m., respiration ceased and the blood pressure could not be obtained. Within 6 minutes 30 seconds, Dr. Churchill had opened up the chest, incised the pulmonary artery, extracted a large pulmonary embolus, and closed the incised wound in the pulmonary artery with a lateral clamp. Despite the rapidity of the procedure, the patient could not be revived. During the long night's vigil, watching the patient struggle for life, the thought naturally occurred to me that the patient's life might be safe if some of the blue blood in her veins could be continuously withdrawn into an extracorporeal blood circuit exposed to an atmosphere of oxygen, and then returned to the patient by way of a systemic artery in a central direction. Thus, some of the patient's cardiorespiratory functions might be temporarily performed by the extracorporeal blood circuit while the massive embolus was surgically removed. And voila, the idea of the heart and lung machine was born. For the next 3 years after he formulated the idea of a machine to take over the function of the heart, Gibbon continues his pursuit in surgery. He thought about the possibilities of building an artificial heart and lung that would be capable to do all the things a normal heart can do. In 1943, with the support but against the advice of his teachers, he spent a year devoted to building such a device. Dr. Churchill provided a small animal laboratory space assisted by his wife, Mary, a technician in Dr. Churchill's surgical research building. There was starting success in 1935 when they were able to support the function of the heart and lung through advanced equipment apparatus. They tested it on a cat, and when the pulmonary artery was clamped off, Gibbon and his wife were able to sustain the life of the cat. The cat was able to be on bypass for 39 minutes. 1 year later, John Gibbon moved back to Philadelphia, specifically the University of Pennsylvania, where he was assisted by Dr. I.S. Rabdin. Gibbon worked on the device for the next 6 years until interrupted by the Second World War. During this time, he had several successful trials with cats, and soon he contemplated an early heart and lung machine to support larger animals. John Gibbon and Mary Gibbon started doing more complex procedures on large dogs and performing intercardiac operations with survivals. After 3 years, the mortality rate decreased from 80% to 12%. By 1953, they decided to move to clinical cases. Dr. Gibbon ran into several barriers of sorts while creating this revolutionary apparatus. A prominent one was the inability to effectively oxygenate the blood. The solution to this problem was solved in 1950 by producing turbulence in the oxygenator. By doing this, they achieved higher rates of oxygen in the blood. This discovery is known as the boundary layer phenomenon. It was by carrying oxygen to red blood cells. While this was being discovered, Tom Watson, chairman of the board of IBM, showed interest in the research John Gibbon was doing and gave him financial and engineering aid to build his machine in a larger, more technical scale. In 1951, they had a working machine known as the Model 1. This was the first of one of many Gibbon could try on humans. The first patient was a 15-month-old baby girl with a severe heart failure. Unfortunately, she did not survive the procedure, but it was because an autopsy revealed an unexpected congenital heart defect. Model 2 was created right before John Gibbon found another likely patient. The second operation was performed on an 18-year-old girl named Cecilia Bevelet and was a success. On this day, on May 16, 1953, Gibbon performed his first successful surgery. The total bypass time was 45 minutes and the circulation was supported completely for 26 of those minutes. The atrial septal defect was closed directly with silk suture. The extracorporeal circuit consisted of a roller pump and an oxygenator made from stainless steel vertical screens over which the blood flowed and produced turbulence, thus providing good oxygen exchange. The vertical screens were enclosed in a plastic shell and oxygen was introduced into this closed environment. Coronary suction was used to recover the coronary sinus blood since the heart continued to beat, and a left ventricular vent was used to eliminate the risk of an air embolism. Saved by anal-thoracic surgery, the patient made an eventful recovery. Just a few months later, on September 16, 1953, Dr. Gibbon spoke of his findings and results at a symposium. Speaking on the advantages of this breakthrough at the University of Minnesota in Minneapolis, Gibbon published a manuscript called Minnesota Medicine in March 1954. At this time, the team had also developed an improved Model 3. His machine was used by another doctor 2 years later on May 23, 1955, by Dr. John Kirkland of the Mayo Clinic. Kirkland made small changes, successfully repairing an atrial septal defect. This was first of many successful attempts of the technology that eventually established extracorporeal circulation, and a method in performing safe, accurate repair without time being a pressure. It took around 22 years of hard work and failures to create this technological masterpiece. It even changed the entire spectrum of heart diseases. Many are the trysts I've had with the mortals here, their bodies offered to my trust, to cut and sew and maybe cure. John Haysham Gibbon, Jr., 1960. Today, the heart and lung machine has impacted the lives of many. It's set a path for more advancements and, pursuing uncharted territory, there has been more development in the heart and how to prolong the life of the heart. The heart and lung machine has left a momentous legacy to the world. It paved the way for other medical breakthroughs and impacted many people who suffer from major heart diseases and defects. To this day, one of the leading causes for death is heart disease. Because of the research and time taken in, someone can be on the cardiopulmonary bypass for several hours during surgery. However, people who have severe cardio issues and may be awaiting for transplant can also be on cardiopulmonary bypass for a span of several months. Patients have actually survived for as long as 520 days thanks to the heart and lung machine. Gibbon's work serves as an important example to surgeons who are struggling today with surgical therapies and technologies of the future. He impacted many medical students and doctors to persevere through difficulties as an example, as well as setting a precedent for pursuing your ideas and dreams no matter how crazy. A very large impact was the countless amount of lives that were saved because of the machine. Operations were performed on several people with heart defects and especially emboluses. In addition, the heart and lung machine set a precedent for other medical breakthroughs and impacted many people who suffer from major heart diseases and defects. In his symposium, he spoke of the hardships and the future of cardiac surgery with devices like this. Just a few years after the first successful surgery with the assistance of the heart and lung machine, in the 1960s the first heart transplant was performed. Then, in the 1980s, researchers at St. Thomas Hospital discovered cooling the heart to below 28 degrees and pouring specific type of chemicals that the heart could be stopped for many hours during surgery. The heart and lung machine has left a legacy for making more efficient heart surgery, a better understanding of the human body, and an example to all people in the world that curiosity can indeed change the world.